Hi everybody, it's Dr. Harry Kestler here from Lorain County Community College with another message from LCCC. What I want to talk about today is this is the third edition. I want to really kind of explain why it is important to adhere to this social distancing principles. And I'm going to tell you a little story about three countries. One of them is Italy, the other one is United States, and the third is Singapore. I'd like to tell you a little bit about their experience. First of all, this curve, I think you've seen this before here. This is China in the beginning of this epidemic, and then as you can see, there is a new tail coming. These are the international cases. These are the non-China cases that are starting to peak again. I want you to also notice what's going to happen very soon here in the United States. We're going to see something like that. That is when the Chinese got better testing and all of a sudden they realized they had more people than possible. We will be going through that in the next few days. By the way, as I am filming this, I have just learned that there is the first confirmed case in Lorain County. So we're heading into the storm. So I want you all to be ready and safe. I've been putting together some information about the number of cases in three places. You'll see here I have Italy, United States, and Singapore. Singapore is hugging the x-axis, which means that it's at 0. By the way, as long as we're talking math, let me wish you all a happy Pi Day. Today is 3.14. I want to show you that the cases in Italy are shown here, the United States here, and the bottom is Singapore. Over here on the right-hand side, you can see that the deaths, there are a lot in Italy, and there are some in the United States. And remember that we are about 2 weeks back from where Italy was 2 weeks ago. Italy looked like this if you look at the numbers. So we're about 2 weeks out. We are hoping that this is not going to look like that. That is why we're going through. That is why the governor put in place so many restrictions, and he was right to do that. He is definitely showing some great leadership in this state. Actually doing a good job that I think the rest of the country is going to start following fairly soon. Okay. I want to reiterate what the problem here is. In Italy, they got too many cases too fast, and they're getting a much higher death rate than they should because the healthcare system clogged. The healthcare system totally clogged up, and you're seeing here, there's pictures of people in beds in hospitals, and this is not a hospital. This is a warehouse, a gymnasium, all sorts of things that aren't supposed to be hospitals are hospitals right now. And they are triaging the care for the people. My heart goes out to the Italians. I have many Italian friends, and I'd just like to say to them, if they're listening, in bocca al lupo. They'll know what that means. And for those of you who want to know a little Italian, it means, may you survive in the mouth of the wolf. And it means good luck. So I'm hoping that they are able to get through this. All right, so we don't want this. This is where people, they're triaging the care and they're not spending a lot of time with the elderly because they don't have resources. So this is why we are seeing such a tragedy there. I'm going to end with a story where this is what you've seen the flattening of the curve now many times by now. This is what we hope we will do. This is what Italy is experiencing right now. They're over the threshold. They're over the amount of health care that they can get from their system. We want to maximize ours. Let me tell you about someone who not only flattened the curve, they practically eliminated the curve. And that was Singapore. This appeared in the Morbidity and Mortality Weekly Report this week. And this is a story of Singapore. They started responding to COVID-19 on January 2nd. And on January 2nd, they started going into and looking at every single case, looking for people who were positive and asking them to self-quarantine and looking for their contacts and surveying them for COVID-19 and their contacts if they came up positive and their contacts. And so the numbers that you saw in that first graph were fantastic. Singapore is a model. We cannot do Singapore. That is way too late. But we definitely can use the principles that they established to make this better. That is, if you have contact with people, contact them and tell them if you're in positive, contact the people you were in contact with in the last few days. Let them know. Let them know that they should let others know. Healthcare is not going to be able to respond to this. We have to be our own public health officers. And that's what you do. You get on your social network and you try to stop people from spreading it, because we don't want to end up with a system, with a situation like they have right now in Italy. I want to thank you all for tuning into these things. I think good information is worthwhile. Remember to be good to each other. And this is really, you're doing some of these things you're doing, and it's terrible. I know it's basketball has been canceled. All sorts of things have been canceled. But please remember, you're doing it to save other people. This is where we are really good to each other, and we rise to the occasion. Stay well, everybody, and may you persist like a lentivirus.